Two well-known motorcycle racers in India are getting behind the wheel of a new vehicle, an ambulance, to aid the country's desperate fight against COVID-19. The brothers are just two of the many volunteers moved to act by the pleas for help on social media and in their communities.
Well, I have seen the visuals where people used to ferry the patients in two-wheelers with an oxygen connected, or lifting their parents and taking it to hospital and running pillar to post. So that actually made me very much sad and emotional that this is not the time to sit at home. This is the time to serve my country and the citizens of my country, and this is my responsibility as a citizen, rather than blaming on anyone, that let me just take it on myself and do my responsibility.
Sohab's brother Murtaza Junaid says the job ranges from picking up patients and transferring them to or between hospitals, or collecting the body of someone who died. And they're doing so even as the risk of COVID-19 transmission remains high. India saw its largest single-day death toll Wednesday, with more than 4,500 deaths reported. That number surpassed the record number of daily deaths set by the United States in January, when just under 4,500 people died. For student Tina Mary Cherian, the need to help outweighs the risks.
No, there's always fear. The fear will constantly be there. But we do take our necessary precautions. We wear the full PPE suit, we wear double gloves, double mask, and we make sure we constantly sanitize. And even we're trying to keep our immunity up as well, so we don't get affected. But as long as you take the precautions, I don't think there's any need to be scared, because these people need our help more than we're scared of. They really need people to be here for them at this time of mourning.
While the country's new cases may be finally flattening, deaths continue to rise and hospitals are still crowded. Mega cities like New Delhi are showing signs of improvement, but there is concern the virus is spreading into the countryside, where most of the majority of the Indian population resides, but where healthcare and testing is limited. It's prompting similar volunteer groups to form there, including people working to cremate the bodies of those killed as a result of COVID-19.
लास्ट 1.5 साल से जो महामारी हुई है कोविड की, उसके अंदर हमारे वॉलंटियर्स सिविल हॉस्पिटल, मेडिकल बीमर हॉस्पिटल और अलग-अलग सब हॉस्पिटल से बॉडी लेते हैं और सब शमशान, कब्रिस्तान पूरी अंतिम विधि हम करते हैं.
India is also warning it likely will be unable to resume vaccine exports until at least October, according to reports, as it diverts shots for domestic use, which will likely make supply shortages worse for the global COVAX initiative. Previl, Global News.